Hi, I'm Jòh-Ann and this is my colleague Physio. We are both physiotherapists with a special interest in pelvic health. September is Sexual Health Awareness Month, and we thought about doing a couple of videos to introduce you to the benefits of coming to see a physiotherapist for sexual health dysfunction.
Jòh-Ann, how would we be treating these conditions we've discussed?
So as we previously mentioned, we do a very thorough complex assessment before we do any treatment. And if appropriate, we will then start treating the patient. So first of all, the biggest component is educating these patients about what their anatomy is and how it functions, how it relates to breathing, toileting, overall posture and movement during the day. After that, we will actually go and start placing our hands on the patient. That might mean starting at the abdomen or the arm muscles or even in the thighs, everything that attaches onto the pelvis. Alright, after we've looked at the overall movement and integrity of the body, we go onto the pelvis specifically. We'll be gloving up and we'll have the patient sit up on the table with the towel over them and then go onto the muscles on the outside first and then onto the inside. When we go internally, often we'll have to wait a little bit at the opening of the vagina because it's a very sensitive area. And then we'll go further in onto the muscles and go through the muscles on both sides of the pelvis. There we'll do a little bit of trigger point release, myofascial release, get them to contract and relax, give them a lot of feedback about what we feel, and we also want the patient to feedback to us about what they feel. One of the tools that we use is dilators. So these are called dilators. They come in different sizes, and sometimes you'll have to start at a very small size, and sometimes you'll be able to start at a larger size to use dilators. We teach the patient how to use dilators themselves so that they have a tool to use at home as well to continue with treatment at home. The dilators have a twofold function. So first of all, they stretch the tissues a little bit, and secondly, they actually train the brain to accept penetration as normal and pain-free, so that these patients can go back to having pain-free, normal sex lives. Nadia, will you please demonstrate to us how to correctly breathe?
I'm going to do it in a lying position, so we take gravity out of the picture. So you basically have two ways of breathing, a primary and a secondary. And primary would be your diaphragm, which main function is to move your lungs. Secondary would be your neck muscles that attach onto your clavicle and ribcage area. And what will happen if they are contracting for breathing is they actually lift your chest to create more space around your lung area, where your diaphragm will move down on contraction to create space in your lung area to get the air in. What happens with over-tight pelvic floor muscles and contractions and anxiety and stress and all of that is we tend to start blocking our abdominal area and to hold these muscles constantly, which blocks the diaphragm from being able to expand and shrink as is needed. Automatically you need to stay alive, and your body kicks in its secondary method, which should only kick in with exercise. So you'll see typically these patients will be breathing sternally with no movement happening around the abdominal area. So proper breathing would be actually that no movement happens over the sternal area and all movement happens over the abdomen. So I often tell a patient to forget about anatomy. There's no lungs. There's a pipe that goes down, there's a balloon in the stomach. And when you inhale, you fill that balloon with air and it expands, and when you exhale, it just goes out again. So I'm going to show you guys wrong breathing again. And then this is correct one.
Now, Jòh-Ann, we've been talking about proper toileting in the sense of how to poo and pee. So how do we need to do it?
We were actually designed to hang behind a tree to eliminate ourselves. So if you look at it, it's that position, which is the squat position. Then the Romans came and gave us toilets, which are wonderful, but along with it came all of the bowel problems that we see nowadays. So you don't need to actually go and squat on your toilet, but you can use modifications to actually get yourself into a squatting position. So what we advise is a small step. You don't need a step. You can use toilet rolls, magazines, whatever you have, just to lift your feet up so that your knees are higher than your hips. Then you want to lean forward with a straight back onto your knees like that. I usually advise opening the legs and just relaxing as well. Together with that, you want to use your nice diaphragmatic breathing that Nadia demonstrated earlier. So you want to let your tummy hang and breathe in to eliminate.